Will my disc herniation go back in place? This is a question I get all the time. My name is Dr. Grant Elliott, here to talk to you about disc herniations. Do they go back in place? Well, you are in luck. Majority of disc herniations can spontaneously regress, meaning that disc herniation recedes back to where it originally came from and is no longer an issue. One interesting fact for you is the worse the disc herniation looks on a picture, on an MRI, the higher likelihood it has to regress, to go back to where it came from, and ultimately to resolve. A little bit counterintuitive, right? Because many individuals out there, the first thing they get is an MRI if they hurt their back, and they're told, oh, the disc herniation is so large, this is so bad, you need surgery right away. And we know that that's not true. The bigger the disc herniation, the better chance you have for it to go back and for it to resolve. With that being said though, we want to make sure we understand that the MRI is just one minor piece of the puzzle, and that the picture or the amount that the disc herniation is out does not determine your success, and it does not determine the level of your pain. So although we understand that the greater the disc herniation is, the more likely it has to come back, it doesn't have to come back for you to be pain-free. That's why the assessment is so important. So what does this mean? That means that majority of individuals, just like you and me walking around, have disc bulges on MRI. I don't have any pain. You might not have any pain either. Many asymptomatic, meaning no symptoms present, disc herniations exist with majority of the population. This is normal. This is normal. So this is why we don't want to let a picture determine the way we feel or determine the level of our success, because maybe your disc herniation is symptomatic, it's causing you problems, and we take an MRI, we see a disc herniation, and we say, oh, the problem for your pain is disc herniations. And you come to me or you go to anybody else and we go through a program together, and then you feel 100% pain-free. You feel incredible. You feel like you can take on the world and you've achieved your goals, and then you go and get another MRI, but the disc herniation is still there. Oh my gosh, are you really better then? The answer is yes, you are better. So we don't want to let the MRI determine our success. We want you and your goals and your level of function to determine our success. So big picture here, yes, discs sometimes will go back to where they came from. They will eliminate, they will regress, and that can be a sign of recovery. But even if the disc is just as far out as it was to begin with, that does not mean you did not recover. If you feel good, if your function is better, if you can do whatever you want without issues. So it might go back in, it might not. Who cares? We want to make sure that you are feeling better and that you can accomplish anything you want to in your life, and that you can live a successful life, achieving whatever you want, pain-free, unlimited, living your life to the fullest. That is what matters. I hope that you enjoyed this video. Please like, comment, and share. Let me know something that you learned. Let me know below if you are struggling with a low back issue or a disc herniation, and I'd love to help.